Calvin in Africa who inspired me to work with, not Bob Langer in MIT, whom I'll go and sit in his lab. So those are some of the things that I can speak up for now.
Very fair. Thank you for those insightful comments indeed. And for all panelists, and now that we have our hybrid online panelists, some that come from actual industry, from the Universal, one of the biggest manufacturing in Africa, as well as perspectives from my Nigeria and other, for us to think, we are in the AfDB annual meetings, and really for us to think, where do we want the financing agencies to help us, right? Build up those, if we say there is a gap, there is a migration out, how do we get to put those offers back? And even for Mr. Zito to think through, what are the challenges when you see of digital technology? For example, similar to Professor Calvin, if he has an innovation, a product innovation, is there space for him? Does he know how to put in a project for you to fund? Are the criteria easy to meet for him to fund? And how do you support the smaller sort of SMEs, medium enterprises and innovations in Africa to ensure that they build and come to the capacities needed? So without further ado, now that we have our participants online, I would like to give the floor to Dr. Egbe Osifo from Anadach Group to give the opening remarks and to allow the other participants to be introduced. Thank you.
Okay, hello everybody. I hope you can hear me this time. So I'm going to try again and with sort of fewer comments. But the one thing I was saying was just listening to Dr. Calvin and Dr. Maraki, and also an earlier session on urbanization. This issue of the African youth is even more critical than ever. 19 and 20 Africans are under the age of 65. In Europe, 1 in 4 Europeans are over the age of 65. And so what does that mean? I mean, so for us, this issue of training youth or getting the youth so that they can have jobs that are quality jobs that are interesting, that can be helpful for them personally to meet the expectations, but also to meet the African economic growth, which is required across all countries, is extremely critical. So if we think the situation is bad now, if nothing is done in 10 or 15 years, it will even be more critical. And given the fact that we're already seeing many young Africans going, sort of migrating in under very difficult circumstances and very dangerous circumstances, I think this is critical on the policymakers and the financiers, to see how do we address this, and the universities and the various folks that sort of prepare the youth for the job market. That's just to add to the context, and so we'll be having different conversations. Without much further ado, we have one of the policymakers with us, the Deputy Governor of Ogun State. I hope you're still online. Yes. Yes, so that you can give us a perspective, I mean, from one of the senior policymakers in one of the largest countries. But I really think that this conversation really will help address this critical issue. What can be done so that young Africans drive our growth on the continent, but we also play a role globally, because we have the youngest population and it's probably one of our largest assets, which if used properly can also help drive the economic growth from elsewhere that has been done with diasporas in, say, China or India or elsewhere. So without further ado, I'm very happy to introduce Her Excellency, Mrs. Noimat Salakoyedele, who is a senior engineer by profession and has always had an interest in healthcare. Your Excellency, over to you, please.
Thank you very much, Dr. Osifo Daudu. Good evening, ladies and gentlemen. It's my pleasure to join this meeting today. Thank you very much, Dr. Osifo Daudu, for inviting me along. The issue of turning Africa's health brain drain to economic gain is one that is very crucial to all of us, as we've heard from the earlier comments. For me, I'm a policymaker, I'm a deputy governor in my state, but I'm also a resident in Nigeria. So the healthcare, the available healthcare to me and my family is also very important. So I will look at it from a policy point of view and also actually what is happening on ground and what is available to our citizens who live here in Nigeria. Nigeria is probably the country that contributes the highest number of medical migrants, for want of a better term, across the world. And this is because, of course, we have a hugely well-educated population. And we have a huge population. We have a lot of movement. Historically, we've been a country of migration. And in the last few years, there's been added pressure on the medical sector because of the demand for additional healthcare professionals around the world. Some people look at it and say, yes, we get net inflow of Forex into the country, but we also have to look at the health of our people on ground. And every day, the ratio of doctors to patients continues to decrease in this country, and this is of concern to all of us. Recently, our state put out job adverts for medical doctors, and we did not have enough applicants to fill the vacancies. That's how critical the situation is. We have hospitals in Nigeria where we have consultants, but no senior reg, no registrars, nobody below them. And all we have in hospitals are consultants and nobody in the pipeline to replace them when they do retire and leave active service. So these are the big concerns that we are facing now. And there's no magic bullet. But one of the things that we are looking at, and which I think this panel should address, is how we can engage the end beneficiaries of this migration. That at the end of the day, if they take every single doctor out of developing countries, it still hasn't met their need. So they have to work with us and let us actually produce more medical doctors, more nurses, everybody in the healthcare space, support us to build better and more improved medical colleges so that we can actually even have the doctors in the first instance before we start to see what proportion of them will be exported to other countries and what proportion will be available for use at home. We should also then continue to work with doctors in diaspora to see how we can have a two-way movement of skills, knowledge, and this will also help develop our own healthcare systems here in Nigeria and in all the countries that are equally affected. I mean, one of the biggest problems we have is over the years, the investment in the healthcare space has been reduced. Healthcare has become more technical and more expensive compared to what we had before. And this has meant that the amount of money which we invest into the primary healthcare does not give us the sufficient investment at the more technical, sophisticated, higher end of the pyramid. So these are things that we as a country are also looking at to see how we can make sure that we provide the tiered level of medical service, or make sure that the people at the grassroots get the basic medical care that they have, whilst also providing specialist healthcare at the top of the pyramid. On a personal basis, the average medical personnel who emigrates is doing it for personal financial reasons. They're going to get better standard of living, better pay. And this is what they want for themselves and their family, and nobody can begrudge them of this. So we also have to look at how we remunerate our medical staff here locally to at least give anybody who doesn't want to live a fairly reasonable standard of living, so that they too can be they're justified in staying back home and contributing to the healthcare of our country. We also, I mean, apart from the nurses and the doctors who are the immediate ones, all the other healthcare sector also, we see a lot of movement out of that. Somebody spoke earlier about pharmaceuticals, R&D and things like that. And I think these are where in our state, for instance, we have a very big manufacturing state, and we're looking to support the pharmaceutical industries here to create like a pharmaceutical industrial park where we can continue to support different companies in that space and bring in skilled manpower, repatriate people from abroad to come and develop that industry here. These are the things that would also make it easier for people who want to practice in Nigeria to practice in conditions that they're happy with, that where they know they can get the drugs for their patients, they can get all the supplies that they need. And if people repatriate as well, they'll be happy to come back. Thank you.
Yeah. So thank you so much, Your Excellency. It was very helpful to hear things from a practical perspective. Maraki, I will hand back to you, but maybe I will ask, I don't know if you have time for Dr. Tulenko's presentation, and Dr. Pamela Jai is on the line, which is part of the panel. So Maraki, I'm handing it back to you. Are you there?
Can you hear me? Thank you so much. Yeah, thank you so much for those remarks, Honorable. I think they were really very relevant. And for us to think, we have numbers, right? And do we need to train all the time at a specialist level where it's really difficult, requires quite a lot of investments? And what about the whole value chain? It's providing job creation for those that are remaining in country, right? So I'd like to hand over to Dr. Kate Tulenko, who's the founder and board chair of Corvus Health, who's worked across several countries in Africa, specifically around health workforce and what are the trends and dynamics. And Dr. Tulenko, if I can ask you, in the interest of time, maybe really highlight to us what's going on in terms of trend, what's sub-regionally, what can we look at in terms of potential solutions to address these in a way that we don't no longer talk about brain drain, but more around skilling our own workforce, because brain drain does think we don't have the numbers for it, right? Dr. Tulenko, please. And I'll
Great. Thank you so much, Dr. Maraki. And if my slides could be put up, and while they're being put up, I'll just do a short introduction of myself. Previous to Corvus Health, I served as the director of the U.S. government's Global Health Workforce Program and as coordinator of the World Bank's Africa Health Workforce Program. And so I'm going to set the stage a little bit about what are the positives and the negatives of migration and how we can minimize the negatives and mitigate them, and how we can maximize the positives. So to start with the positives, there are, of course, remittances. We know that billions of dollars come in to Africa every year from overseas workers and get invested in their families. There's also stronger business ties between African countries and high-income countries, which helps lead to foreign direct investment. You have the flow of ideas in medicine as well. The idea that health workers overseas can bring back the latest technology. This may or may not be appropriate, so that's just a caveat on that. Also, people talk about return migration. That rarely happens, and later we'll talk about some things that we can do to increase the likelihood that return migration will happen. And then also another positive impact is that through the diaspora providing healthcare in the destination countries, often folks from the diaspora can receive healthcare from their own people. For example, someone in Minnesota from Somalia who only speaks Somali can get healthcare from a Somali physician who's in Minnesota as well. So that's an example of a positive. Now, on the negative list, unfortunately, there's a much longer negative list. The negatives on the origin country is, of course, the loss of care. You know, every physician that leaves represents 2,000 to 10,000 people who now can't get medical care. And there's a lot of data on this. Also, there's, of course, the loss of the educational investment. This is estimated to be in the billions of dollars.